Most people experiencing persistent waist pain assume it's solely a structural issue requiring medication or invasive procedures. But recent clinical findings from leading orthopedic rehabilitation centers reveal something far more concerning. The majority of chronic waist pain in adults over 40 stems from deep muscular imbalances and core instability that conventional treatments completely overlook. This hidden reality means countless individuals continue suffering despite following standard medical advice. Today, I'll reveal exactly how long it takes for most adults, particularly those over 50, to experience measurable relief from waist pain when addressing it through the correct approach, a timeline that might surprise you and challenge what you've been told. And I'm going to share 3 medically approved exercises that don't just relieve waist pain, but simultaneously strengthen your entire core foundation, improving your posture, mobility, and long-term spinal health. But here's what most people don't realize until it's too late. One of these exercises targets a specific muscular weakness that, when left unaddressed, silently accelerates disc degeneration and nerve compression, even in people who consider themselves relatively active. According to research from major rehabilitation institutes, this overlooked factor is present in over 70% of chronic waist pain cases, yet it remains virtually unknown outside clinical settings. Understanding how long it takes to see genuine relief from waist pain is critical because unrealistic expectations lead most people to abandon effective solutions prematurely. Here's what's becoming clearer from physical therapy research. Adults addressing waist pain through targeted core stabilization exercises typically notice initial improvements within 10 to 14 days of consistent practice, particularly reduced morning stiffness and improved movement tolerance. Substantial pain reduction and functional restoration usually require 4 to 6 weeks of regular engagement, with maximum benefits appearing around the 8 to 12-week mark, at least in most cases. This timeline varies based on pain severity, age, and underlying muscular compensation patterns. For individuals over 50 or those with prolonged sedentary habits, the initial phase may extend slightly longer as dormant stabilizer muscles, these are the deep muscles responsible for spinal support, reactivate. What's crucial is that these exercises work by restoring proper biomechanical function rather than masking symptoms, which explains why results build progressively rather than appearing overnight. Like I said earlier, understanding this timeline prevents premature discontinuation and establishes realistic milestones for tracking your recovery. The 3 medically approved exercises that deliver these results are what we'll explore now. Posterior pelvic tilt hold. The posterior pelvic tilt hold targets a critical, yet frequently overlooked muscular weakness that affects over 70% of people suffering from chronic waist pain. I'm talking specifically about the lack of activation in the transversus abdominis, which is basically your body's deep internal corset, and the pelvic floor muscles. It's a bit of a mouthful, but these muscles form your deep core stabilization system. One research, actually a surprising one, published in Nutrients, is making it clearer that this specific deficiency silently accelerates disc degeneration. It does this by allowing an excessive anterior pelvic tilt, which is just a fancy way of saying your pelvis is tipped too far forward, putting a lot of pressure on your lower spine. What's particularly insidious, or at least frustrating, is that this weakness persists even in active senior men and women who walk regularly. Walking just doesn't hit these deep stabilizers effectively. Like I mentioned earlier, we're trying to fix that postural deviation. To do this, you'll lie on your back with your knees bent and feet flat. Gently flatten your lower back against the floor by tightening those lower abs. Think of it like tilting your pelvis backward or tucking your tailbone under. Now, hold this while breathing normally. Don't hold your breath. Major physical therapy associations usually suggest holding for 10 to 15 seconds, repeating it about 8 to 10 times. I've seen this confuse people because it feels too simple to work, but for those over 50 dealing with stiffness or early-stage degenerative issues, it addresses the biomechanical root cause. It isn't just masking the pain, it's actually redistributing the load across your spine, for the most part. Next, let's look at the side-lying hip abduction. What's surprising here is that about 60% of chronic waist pain cases are actually made worse by weakness in the gluteus medius. That's a hip stabilizer on the outer pelvis, something prominent sports medicine institutes have documented, though most people still overlook it. I've noticed this muscle often gets ignored because we focus so much on the back itself, but this exercise is significant because it stabilizes the pelvis during things like walking or climbing stairs. When that gluteus medius is weak, your pelvis drops toward the unsupported side when you move. It's a pattern called Trendelenburg gait, which sounds complicated, but it basically just means your lower back muscles, like the quadratus lumborum, have to work double time to keep you upright. This chronic overload is what really generates that persistent waist pain, at least in many cases. The part people miss is that things like massage or anti-inflammatories don't fix this imbalance. They just mask it while the dysfunction gets worse. To do this right, lie on your side with the bottom leg bent and lift the top leg to about 45 degrees. Hold it for a second, then lower it slowly. Now, one research, actually a surprising one, suggests that while this helps almost everyone, it's especially vital for women over 60. Hormonal changes can cause this specific muscle to thin out or atrophy faster than we'd like. Like I said earlier about the deep core, we're trying to stop the back from overworking by making the stabilizers do their job. Aim for 12 to 15 reps, maybe 2 or 3 sets, twice a day, if you can manage it. If you're new to the Health Waiver community and would love to join us for free, where we share tailored health tips specifically designed for seniors just like you, please take a moment to subscribe. We'd also love to hear from you. Comment below and let us know how old you are and how your health has been lately. Your engagement helps us create content that truly serves your needs. Lastly, we have the dead bug with heel tap. I've seen this one help people who feel like they've tried everything else. One patient, a retired administrator, who actually struggled for months with pain every time she just reached for something or bent over. Conventional physical therapy just wasn't cutting it for her. This specific movement is interesting because it targets a muscular imbalance that many specialists now agree is the real culprit, the inability to keep your spine stable while moving your arms or legs. It's basically training your deep stabilizers, specifically the transversus abdominis and the multifidus, to stop your lower back from arching or hyperextending when you're just going about your day. To do it, lie on your back with your knees bent at 90 degrees in the air. Slowly lower one heel toward the floor, but here's the key. You have to keep your lower back glued to the ground. If it arches, you've gone too far. It looks a bit like a bug on its back, which I guess is where the name comes from. Usually about 8 to 10 reps per side is the sweet spot, though outcomes vary depending on how your back feels that day. People rarely talk about this part, but it's really about restoring that neuromuscular coordination, basically teaching your brain and muscles to talk to each other again so you can move without that sharp pinch in your waist. These 3 exercises, the tilt hold, the hip abduction, and this dead bug, work because they focus on the foundations of waist pains. Like I earlier mentioned, the goal is to master the technique first rather than rushing through reps. Start with one that feels manageable, then add the others. I'm curious, which of these surprised you the most? Subscribe to stay updated on these tailored health tips for senior men and women, and please comment below with where you're watching from. Thanks for being part of the Health Waiver community.